Well, the best part about walking on the beach are the seashells, the fresh air, the wind in your hair, just the sound of the waves. I've been doing this all of my life, and I was afraid I was never going to be able to walk half a block again. I thought I had a back problem because of a broken back much earlier, and the pain was from the back. Then later on, the pain became abdominal in the stomach. I wasn't eating. Well, I was hungry, I was starving. I wanted to eat. Every time I ate, I hurt. And when I didn't eat, I hurt. It kept getting worse and worse, and then I started losing weight, 32 pounds in about 6 months. I wanted an MRI for my back, and I asked my doctor for that. And about 2 weeks later, I got a phone call saying that I had an aneurysm on the aorta. He said, I want you to go immediately to the hospital. And I sat down and started crying because my grandmother died of that. The vascular surgeon there said, there's nothing I can do for you. And so I said, now what do you do with me? If you can't help me, where do I go? And he said, there's only one doctor that I know of that can help you right offhand, and that would be Adam Beck in Gainesville.
Ms. Dickinson had two problems. She has a very large aneurysm right here, and you're just seeing the inside of the blood vessel. It was close to 8 centimeters in diameter, which is quite large, and also had a near occlusion of one of the main blood vessels that goes to her intestines, and she had an occlusion of 2 of the 3 blood vessels, so her only blood vessel going to her intestines was nearly blocked, and that was probably what was causing her pain, but her bigger problem really was a large thoracoabdominal aneurysm. She was relatively complicated because of those 2 combined issues. We felt like she was too ill to undergo an open thoracoabdominal aneurysm repair, which is a big operation. What we did was we put a stent into her superior mesenteric artery, which is the blood vessel to the intestines. We gave her a short period of time from that procedure to recover. About a month after that, we did her endovascular aortic repair. She did very well. She immediately felt better. Her back pain was better. Her abdominal pain before that procedure was already better because of the stent in her artery. Since then, she's done very well.
So he gave me my life back.
Some of the joys and what she enjoys doing is carving of pumpkins. So here are the pyres doing pumpkin carving 6 months after surgery. And here are some of the pumpkins in which she did. And hers is the one in the middle. I love you, Mama.
I love you, sweetheart. I appreciate every day, every minute I get. You don't appreciate it till you think you're going to lose it. Life is good.
To have that good of a result that somebody's that happy about definitely makes me happy to come to work every day.
I put my life in his hands more than once. I would do it again.
I think what we offer that's different at the University of Florida is not only the skill set that we have to manage some of these very complicated problems. This is really most of what we do is these kinds of complicated aortic problems. But we also have a really good interaction between the surgeons that do it and the different disciplines that do these sorts of operations, which allows us to really provide very advanced care in a collaborative environment.